Welcome to the SOAP POCUS video series. Today we will discuss how to use point-of-care ultrasound in the differential diagnosis of acute respiratory failure in pregnancy. We will guide you through the following algorithm, which combines pulmonary ultrasound and cardiac ultrasound. This decision tree was published in a review article on point-of-care ultrasound in pregnancy in anesthesia in 2018. After approaching our patient and performing a clinical examination, we start with the pulmonary ultrasound. The presence of anechoic fluid, which can be easily identified on ultrasound, indicates pleural effusion. Presence of a lung point is pathognomonic for pneumothorax. Please see the lung ultrasound chapter of our video series for details on diagnosing pneumothorax. Assessing pulmonary tissue can reveal three different lung ultrasound profiles: an A-line pattern, a B-line pattern, and lung consolidations. An asymmetric profile with unilateral B-lines or lung consolidation suggests pneumonia or atelectasis. A bilateral B-line pattern on lung ultrasound indicates cardiogenic or non-cardiogenic pulmonary edema. Lung ultrasound is an easy, highly sensitive tool to detect increases in extravascular fluid early in the course of disease. However, in many cases, lung ultrasound does not allow differentiation between pulmonary and extrapulmonary lesions. Therefore, as a next step, we will perform a transthoracic echocardiogram, or TTE. Significant systolic dysfunction, or raised left ventricular end diastolic pressure with preserved systolic function on TTE indicates cardiogenic pulmonary edema. Please find details on how to assess cardiac filling pressures on the TTE diastology chapter of our video series. Normal filling pressures and B-lines suggest non-cardiogenic pulmonary edema, which characterizes acute respiratory distress syndrome. On the other side of the decision tree, acute dyspnea with a normal lung ultrasound, indicated by an A-line pattern, can be seen in pulmonary embolism, tamponade, or bronchial disorder. A TTE may assist in narrowing down this differential diagnosis. The presence of acute right ventricular failure, as suggested on this image, together with the presence of deep venous thrombosis on ultrasound of the extremities, suggests pulmonary embolism. Pulmonary embolism may sometimes present with an asymmetric profile with subpleural consolidation on lung ultrasound, particularly in the case of pulmonary infarction. Alternatively, performing a TTE with an A-line pattern on lung ultrasound may also reveal pericardial effusion with tamponade physiology. Absence of either acute right ventricular failure or pericardial effusion with A pattern on lung ultrasound points towards a bronchial disorder. To conclude, the combination of lung ultrasound and TTE is a superior diagnostic approach compared to lung ultrasound alone. In the setting of acute respiratory failure in pregnancy, this diagnostic approach reduces the need for advanced imaging, facilitates prompt diagnosis, and guides treatment. Thank you for watching.